All right, well, we are here at ASAP's 2019 in New Orleans with Dr. Heil, and we are going to ask you some questions about the artist's hair restoration system.
That's great. One of my favorite topics.
All right, well, let's get started. First off, what are some of the most common causes of hair loss today?
Well, I think the overlying greatest hair loss cause is male pattern baldness from genetics, but I think a lot of it's compounded by diet, poor diet, nutritional deficiencies, stress. You hit some major stressful period in your life, and suddenly you go from slow hair loss to an accelerated, oh my God, look what just came out in the shower. So there's a lot of things that exacerbate it. I'd say genetics is the biggest underlying problem, and then on top of it, probably nutritional deficiencies and stress.
Awesome. What is the average age that most people start experiencing balding or hair loss?
I'd say they start experiencing it probably late 20s to early 30s, but it really starts bothering them probably mid to late 30s.
Okay.
Because if you're heading into your 40s and you're already looking like you're heading into your 50s or 60s,
Yeah.
suddenly you want to do something about it, and if you're not living in your parents' basement any longer, maybe you have the wherewithal financially to do something about it.
Yeah. Does everybody bald usually at the same rate once they start balding, or is there different?
No, some are just sort of slow and steady, and then, like I said, they can be slow and steady, and then hit a major life stressor that speeds it up. There's others that, gosh, I've transplanted 18 and 20-year-olds who were as bald as their father that brought him in at the age of 45, and you got a 20-year-old kid who's got the same hair loss as a 45-year-old. And then other people will just be sort of slow and steady and just sort of be 5, 10, 15 years ahead of where they really are chronologically, that they're 30 but they look like they're 45, and it's taken 15 years to get there, and it's sort of sneaking up on them.
Yeah.
and then the call to arms is whenever someone sends them a photo from that wedding they were at, and they thought they were getting along just great with that bridesmaid until they caught their thinning crown in the back of the photo, and they come running in like, oh my God, I gotta do something about this. And it's like, well, you've been thinning up here for 10, 12 years. Yeah, but I just saw this little reflection in my crown. Now I got to do something about it.
Or you see one of those photos from a while ago and you don't even realize it
Yeah.
until you look at a photo side by side and go, oh no.
Yeah. Oh, absolutely.
Well, speaking of that, is there any sort of stigma around hair loss today? Or been experiencing hair loss?
I think, there's a stigma of hair loss, and there's a stigma of replacement.
Okay.
The stigma of the hair loss, it used to be that, oh, well, you're distinguished. If you're wiser and more senior, it's okay to have the hair loss. And now it's, you don't want to look older than you are. You want to look like you're, as competitive as young guys like you. And, someone else who looks, 15 years older than they are, they don't feel like they're as competitive in the workplace, or they don't have that confidence. And they could be just as good as anybody else, but they lose that confidence, they lose that edge, and they feel like, that's putting them out of the game, whatever game it is, whether it's with the opposite sex, whether it's professionally, whether it's just feeling good about yourself. And then there's also the stigma of, your father's hair transplant, the cornrows, so there's a stigma about talking about it, because right after talking about hair loss, you're talking about, what am I going to do about it? And oh my gosh, I don't want cornrows. I don't want that strip scar in the back of my head. I don't want, my uncle, he couldn't lay on his head for a month after he had that awful barbaric procedure. And so it's that stigma also to overcome, realizing that's not hair restoration anymore. Now It's invisible. Now it's scarless. And that almost stands in the way of people reaching out and trying to do something about it too, because they think that's what this is about, and it's not at all about any of that old-fashioned hair restoration.
So in essence, that's what Artis has done to kind of get rid of that whole stigma.
It's totally revolutionizing it, and they're doing everything they can to educate and to bring it to the public's eye, sort of from the technology standpoint. Although it's not all about the technology, it's about the finesse, it's about the precision, but it's not hard for people to understand, like, well, if I'm going to have something cut or lasered off, I want the cool laser. Well, if I'm going to have it restored with, knives and stitches, or am I going to have some robot that's really cool that can do it faster and better and more consistently than Dr. Heil can with his own little hands? if I'm going to have my gallbladder or my adrenal glands or prostate operated on, I want them to use a robot to do it now.
Yeah.
And I want to go to a surgeon who uses that robot in their belly surgery. Well, there's only one robot in the world that can replace your hair. And they can do it 3 or 4 times faster than you can with any other method. And the hair grows sooner, faster. It's even more comfortable procedure and more comfortable recovery. And it's more precise, it's more consistent than anything I could ever do over the last 18 years. The last year of using the ARTIST robot in our practice has totally revolutionized how we do hair restoration. That's
awesome. Is the ARTIST system, is it a permanent solution?
It's a permanent solution to an evolving problem for a patient. So you may continue to lose hair, but everything you restore is there forever. So, you can work on, putting a new roof on, the front part of the house, but the back deck may need some work later on, but you're not going to have to replace that roof on the front part of your house in another 15 or 20 years.
Okay.
So what you restore, that's permanent restorative results. So that, you can put whatever you do into your car every year, and in 4 years, it's going to be gone. You're going to be turning the car in. It's gone. You put it in your hair, you restore that frontal hairline, the temples, your forelock, it's there forever. You restore your crown, it's there forever. But we also focus on preservation because it's a moving target. There's more hair that's disappearing and thinning and miniaturizing and dying off that then gives you more need for more restoration. So if you can slow or halt your loss and begin to replace what you have already lost, then it's a win-win.
Mm-hmm.
It's not like you're trading out permanent hair for thinning hair and you feel like you're trading water. You actually want to gain presence, gain, a frontal hairline that isn't chasing backwards. So, what you restore is permanent. Yes, absolutely.
So is there anything that men can do after or before, during, to help the process?
Yeah, that's the whole basis of our preservation program is there are low-level light therapies, nutritional supplements, platelet-rich plasma treatments, and some patients aren't ready for restoration, but they certainly are ready for preservation. And we get them started on that, and when it's time to consider restoring what's lost rather than what's sort of thinning and losing some ground, then they can restore as well. And they can have a robotic hair restoration that permanently replaces what's gone, but they keep preserving what they have. You don't just say, to heck with the loss, I'll just keep putting it back in. You want to slow it down and get the most out of, that's how you get the most out of the restoration, is to preserve everything else.
That's awesome. And then my last question is, how have you seen artists not just affect the physical appearance, but their overall well-being of men after they've gotten the procedure?
Well, it's pretty incredible. I mean, the way they come back with more confidence, the way they dress, you hear the stories about what's going on in their life, and it's kind of, with more enthusiasm, sometimes a lot more confidence takes them into new situations that, they took a step, they took a jump with their hair restoration. Now they're going into all kinds of things in life with more confidence. Honestly, some are a little more shy about things, and it brings out their experimental side of them. Hey, I'll try to go for this. I'll be more spontaneous. I'll be a little more gregarious and not shy away from situations where I feel a little timid in. And they feel better in some of their relationships. Sometimes they may be in a long-term relationship with their wife, their significant other, and they just feel like they're not always bitching and moaning about something that, they finally got off their duff and they said, hey, I'm going to do something about that. And their influencer, their wife, their girlfriend said, do this for yourself. You're always, complaining about it. Shut up and do this. This is what you've been waiting for. You're waiting for this, starstruck technology. It's here. It's here. Now do it. Put your money where your mouth is. Restore your hair and let's move on. And so it changes kind of their, it's almost like they come in and the wife says, yeah, I told you so.
It's so funny. We've always
now it's time for me.
There's so many things out there where you go, man, if a robot could just do it and do it perfectly, then that'd be great. And we finally have something. Yeah.
It's everything that's cracked up to. There's so many things in life where it's all hype and it's all kind of overstated, hyped, and this is really almost under promoted because people don't realize that it exists in a lot of scenarios because it's very new. It's been developed for 8-9 years, but it's very new at its current stages where it's taken the world by storm, and there's probably less than 200 in the world. But we're lucky enough to have one of the major centers right in Pittsburgh, Western Pennsylvania area, and patients drive 5, 6, 7 hours for this. They'll fly across the country for it because it's not like anything else out there.
That's awesome. Well, hopefully more and more people learn about it.
Yeah, that's what we're hoping. Just trying
Yeah.
to get the word out and educate one patient at a time and make one happy patient at a time.
Awesome. Thanks so much for sitting down with us today.
Oh, thanks for the opportunity. Appreciate it.